major metabolic deficit. So we can anticipate that phase 1 is going to be sustained. It's going to be a prolonged inflammation. And we have abnormal migration. The cells don't go to the right place. Remember also we have phagocytosis via the macrophages. The macrophages are very important to remove the devitalized tissue from the wound bed. So concomitant with the fibroblasts to grow the tissue, the macrophages clean all that dead tissue away. Because we want to make sure we have the establishment of fibroblasts to produce granulation tissue. But in phase 1 diabetes, we have a major deficiency of subcellular mechanisms. Then we go to phase 2. We see the migratory phase or the proliferative phase. We have problems with growth factors. And here's another thing I want to mention, MMPs, matrix metalloproteinases. Those retard wound healing. If we do not have wound healing, we're encouraging the accumulation of matrix metalloproteinases in the wound bed. And these MMPs will contribute to a chronic wound. And I'm going to show you in a few slides from now how we can control the MMPs and reduce the MMP population. We want to make sure we can influence the submolecular mechanisms in the wound bed to be able to produce granulation. Our goal as clinicians is to produce granulation tissue. That's our main goal. Okay, so we see here that we also have poor migration. We know that proliferative capacity is diminished and vessels and epithelialization is not to its maximum, and the extracellular matrix doesn't happen to form that correctly. Because we need the extracellular matrix, which is our foundation. It's our scaffolding. All right? And phase 3, we have problems with the remodeling phase. So we see diabetes affects every phase of wound healing. Every phase. And if you can't cure diabetes, which we don't have a cure, and that would be idiopathic or idiotropic type to get that problem solved, we have to go to symptomotropy. Approach the symptoms of the disease. And that's what we're going to do today. Okay, so here's the solution. I talked to you about the problem, diabetes. How can we heal a wound in a patient who has chronic diabetes? And the answer is collagen. Collagen. Now I know there are so many wound products out there. The Kestrel Wound Encyclopedia is this thick with wound products. But I'm going to tell you one thing. I'm going to give you a great secret today and let you know that collagen, you're going to fill it with wood. Same principle in wound management. If we have a deficit or a void or a breach in the dermis, we're going to replace it with collagen because 90% is type 1 collagen. We see that collagen is the most abundant protein in the body, comprising 30%. And it's in the form of a braid. It's a tightly coiled triple helix. And I'm going to show you a picture of that in a second. What's the take-home message here? Is that the fibroblasts and the collagen, they cleave. And they form that biologic template in the wound bed. They form the relationship, the matrix, the scaffold to grow granulation tissue. Fibroblasts, collagen, granulation tissue. That's the major take-home message. That's the solution to the problem, is the consideration of collagen. And here's that structure. We see it's a tightly coiled triple helix. Every protein, as we know, we remember from our science, every protein has the establishment of amino acids. They're the building blocks of proteins. Specific to collagen, we have 3 wonderful amino acids. We have proline, hydroxyproline, and we have glycine. By the way, meet the cofactor of vitamin C. Okay, ascorbic acid is the cofactor for the metabolism of collagen. Patients who have scurvy have decreased vitamin C, decreased ascorbic acid, and they don't heal. Okay, you remember reading our history, the boating coming from Spain when they're coming to the New World, and a lot of these sailors died because they weren't replenishing their ascorbic acid vitamin C level. They were bleeding out. All right, so this is what we see. We have the amino acids in a unique sequence. So I just want you to be familiar with what is so important about this wonderful molecule. This is what we have. Okay. The fibroblast, as I keep mentioning it, I'm going to keep mentioning because it's so significant. Here's what we need to know. The fibroblast has a unique cellular morphology. Most cells in the body are somewhat round, okay, except their exception of some specialized. This is a specialized cell. We see here that the nucleus is an elliptical nucleus. And look at the cytoplasm. Branched cytoplasm. So the cytoplasm is able to grab the collagen, remember I said cleave it, to form that framework, that scaffolding. And what do we have? We have the establishment of a wonderful biologic scaffold matrix to grow new tissue. Great cell, specialized function. It will heal your patients who have diabetic-induced wounds. Very important. So kindly know this. And here's another concept. This cell contributes to the stromal integrity of the tissue. So what's stroma? We see some organs in the body have two major components, the stroma and the parenchyma. The parenchyma, I'll give you an example, let's talk about the lung. The parenchymal structure of the lung is the alveoli, where you have the gaseous exchange. But the alveoli have to attach to the stroma. Think of a bunch of grapes. So the grape is the parenchyma and the vine is the stroma. Same concept in wound healing. This is your stromal makeup. This is your stromal composition and your contribution to establishing that framework, the foundation for healing. Okay, this is probably one of my favorite slides. It has a lot of information on here. I'm not going to go through everything, but here I want to just point your attention to a very important thing. I like to look at this slide as if it's an orchestra. Okay, so those who like classical music, join me in thinking this is a symphony. What's the conductor of the symphony? The fibroblast. So here we have the string section, the horn section, the percussion section. Here's the take-home message. The fibroblast influences all of these subcellular mechanisms that get to an endpoint, and the endpoint is the production of granulation tissue. So look, the fibroblast induces migration. The fibroblast is responsible for the extracellular matrix production because we want to have that scaffolding or that template. The fibroblast induces growth factor release. In order for us to grow tissue, or in order for the body or a cell of the body to do a specific function, it involves growth factors. Whether it's platelet-derived, endothelial-derived, fibroblastic-derived growth factors, whatever growth factor, it is important. Also, angiogenesis. Here's the simplicity of angiogenesis. If we want tissue to thrive, we have to give it a blood source. If we have a plant, we want it to grow, we have to water it. So angiogenesis from the Greek means establishment of a blood supply. It's similar to neovascularization. So angiogenesis, amazing principle and property that the fibroblast has the influence to induce angiogenesis. and it induces it via growth factor.